Okay, another great episode of the Ortho Show podcast. We're bringing on one of my favorite orthopedic surgeons, one of my go-to guys. He is a brother of another mother, kindred spirit when it comes to innovation, professional education, industry relationships as well. His name is Dr. Rob Meislin. He's an orthopedic surgeon, sports medicine specialist out of NYU Langone in New York City. Just so admire this man as far as what he's done with his 30 years of experience. He got stuck in New York for a long time, then went to Arizona, has spent time in Israel, which I truly admire. We got to talk about that. And then back in clinical practice now. The things that really stick out for me are his passion for mentorship, his passion for understanding new operations early on, is not afraid to wait for a randomized controlled trial to make a decision, but really if he sees something that's innovative and he's willing to take on the risk and the curves to try something new and different. I really think you're going to appreciate this episode as much as I do. Dr. Scott Sigman, #follow the fro.
From medical media, this is The Ortho Show.
Hello, world. Dr. Scott Sigman, your favorite opioid-sparing orthopedic surgeon, here for another episode of the Ortho Show podcast, where everyone knows we bring you the best of the best in orthopedics. I am super excited for today's episode. We have Dr. Rob Meislin on, orthopedic surgeon who's a sports medicine specialist, clinical professor at the Langone Medical Center in New York City. He is literally one of my go-to favorite orthopedic surgeons for his innovation, his professional education, his mentorship. The dude's got a lot going on. Rob, what a pleasure it is to have you on, brother.
You're just much too kind, Scott. I mean,
it's the truth, man. We speak the truth.
I'm just amazed at in terms of what you personally have accomplished in terms of spreading this whole footprint of mentorship, teaching, professionalism.
No, I appreciate that very much, man. We take great.
I got to put my Narcan away. Your opioid sparing. I can put the Narcan back in the box. The genie in the bottle.
Yeah. There's no need for any Narcan today. We're going to get through this podcast. No one's going to have any respiratory depression. It's all going to be good. All right, man. Let's. Well, I appreciate that very much, Rob. You know, this has become a labor of love. It's such an amazing thing to be able to share the stories of someone like yourself who has 30 years experience, clinical experience in orthopedics. And, we always like to start from the beginning, right? So you're New York City, baby, born and bred, you barely got out of there, but give us the story and tell us, where you were born, were your parents doctors, when was thought for doctors and orthopedists and all that good stuff?
Well, that's a audacious question. Well, let me start by saying that my father's a pediatrician, and he was a medical captain in Fort Detrick at the time. I was born in 1959, a baby boomer, a 50s baby, and he was working on biological warfare. Big secret at the table when I got older was that biological warfare didn't necessarily work, but the Russians didn't know it at that time.
So back up for a second. A pediatrician is studying biologic warfare?
Well, he was, early on in his career, and he was in the Army. I think it came more into the story later on. I think in the 90s or 2000s when they kind of traced anthrax to Fort Detrick, to somebody working on it there.
No kidding.
So nonetheless, 1959, I'm actually born in Walter Reed Army Hospital as a result. So that's my one connection to DC. And then they moved back to New York City in 1960. And then I grew up on the Upper West Side of Manhattan.
And it's interesting. We're going to talk about this as we get going. It's like, you literally, you didn't leave Manhattan for a while there once you got there. But so you grew up in a Jewish community and you go to Ramah's Upper East Side for high school, which is a Jewish high school and still is at this time. And so, what was that experience like for us?
So actually, I went there from kindergarten all the way through 12th grade. Real formative training. I think I got my dose of Zionism and my love for Israel. As a result, I was able to learn Hebrew, speak Hebrew. And it was a great balance for me between secular education and religious education. I myself am more traditional, not necessarily Orthodox, but very, very Zionistic.
We'll talk about that because you spent some time in Israel. But so you literally were able to become fluent in Hebrew while in your high school and middle school training?
I wouldn't say fluent, but key words. I could read the prayer book. I went to Israel a number of times, so it kind of got an additional dose of learning Hebrew. It wasn't until later on, and where we moved to Israel, my Hebrew improved.
There's one sentence I can clearly remember from Hebrew school, and that was "Sheket b'vakasha," which for our listeners means "shut your mouth," which I guess apparently I was doing a lot of talking in the back of the class rather than paying attention. But "Sheket b'vakasha" still rings true for me to this day. That's too funny.
I was going to say it was channeling your future direction.
Yeah, exactly, for sure. No, I love it. So you're stuck. You can't get out. You can't get off the island. So there's a lot of great options to go to school in the world, but Columbia calls you for undergrad, which obviously was an amazing, a school to go to. Very difficult to get into, but just a train ride away from home, which is kind of cool. And so from then Columbia, you still had the calling, but we still don't know. So Dad's a pediatrician. At what point are you thinking medicine, orthopedics? Was it obvious, or did it take some time?
Actually, I hate to admit this, but I think it was a girlfriend at the time kind of said, "Oh, you're going to be a doctor, aren't you?" And I guess I said yes. So, between that and my father as being an excellent mentor as a physician in terms of how much he enjoyed it, medicine was my calling. I think it kind of gave me a direction to go into. Again, this is in the late 70s, where entrepreneurial endeavor was kind of low. I have so much admiration now for the people that do it. But back then, I guess it was somewhat the way to go, whether you're going to be a lawyer, a doctor, a professional. And I certainly had the role model with my father to follow in that footstep.
Yeah, I mean, a nice Jewish boy from the Upper West Side, you didn't have too many choices. You're going to be a doctor or a lawyer, probably. But having said that, but it's interesting you say that, because in the 70s, right, it's Jimmy Carter's the president. Interest rates are like 20%. Gas is kind of crazy. There wasn't really a lot of opportunity for business at the time. We were really struggling in times of economic downturn. I think professional schools in particular typically do well. So then it's all right. Well, you had clearly you weren't leaving Manhattan, but the good news is there's like 4 medical schools in Manhattan. So you applied all 4 of them or whatever, and you get into NYU when you're going to medical school.
Right. Went to NYU. Just a quick story, Scott, was that I think my first medical school interview was at Buffalo at the Millard Fillmore School, from what I remember. And what sticks out is that when I landed that night, John Lennon was shot dead at the Dakota.
Oh, wow.
I think it was December 7th or December 8th of that 1980, when I was starting to interview. And it kind of channeled my love for the Beatles. I'm a huge Beatles fan. So just a little medical school vignette. And we were all
and the Dakota, how far was the Dakota from where you grew up? I mean, that was...
So just for people that aren't that familiar with New York City, Columbia is about 116th Street and Broadway, and the Dakota is at 72nd Street and Central Park West. So 20 blocks to the mile. It's an easy jog. It's within shooting and running distance.
I'm sure when you came back, did you go and lay down a wreath or put some flowers down or something and visit?
We eventually went back a few days later and walked around there, because I'm sort of a history buff in some sense.
Yeah, no, it's interesting. I was in high school at the time, so have interesting memories for that as well. So you decide you're going to stay at NYU. All right, Dad's a pediatrician. When's this whole orthopedic thing coming into play?
I was a high school student. I remember my father was a pediatrician at NYU. He got me in on one of the most renowned heart surgeons. So I remember watching this cardiac surgery as a young buck, and I was just like, I think I just fell in love with the whole concept of surgery, in terms of what it was going to entail and what was involved. Certainly my exposure to general surgery and cardiac surgery. I mean, I personally came away, I felt as though the general surgeons were a bunch of unhappy guys. And when I had a little exposure to orthopedics, I didn't really know, much about orthopedic surgery growing up, other than the fact that I was a jock. I played a year of college basketball at Columbia. Enjoyed sports, had my own shoulder dislocation actually when I was 16 years. I looked more into it, and I thought that orthopedics would eventually be a great field to apply for. I didn't want to sit there and be on the receiving end of listening to patients complain about everything A to Z and not being able to actually get that. Plus, we all have a thirst for some immediate gratification. So I think it all worked out well.
I gotta tell a funny story. My wife's probably gonna kill me, but I was at a Shiva in on the Upper East Side for my dear friend Scott Kurzman. I went to college with him, and he still lives in New York. And I'm hanging out with my wife, and we're in the midst of this, Upper East Side, like, Jewish huddle of things that are going on. And this woman comes over to my wife and says, you're engaged to Dr. Sigman? And she says, yes. She's like, well, how did you get a Jewish orthopedic surgeon? My wife is an Italian Catholic girl. She's like, who are these people? I'm gonna get out of here. Oh, it was a classic story. We've never forgotten it to that moment. But yeah, a Jewish orthopedic surgeon in New York is a big deal. But all right, so you're at NYU School of Medicine, and you get the bug, and you still can't get out of Manhattan. So you look at the 4 or 5 residencies that are there, and you get into joint diseases, which now it's not even called joint disease anymore. It's NYU Langone, which is where you are now. But, at the moment, at that time was still one of the greatest, residencies to get into in orthopedics at the time in the late 80s or so when you were there. So that was a tremendous accomplishment.
Right. I mean, I think I applied to maybe 8 programs, and I got into Jefferson. I was very impressed with Jefferson. My wife is from Philadelphia, so there was somewhat of a natural connection there. And then I found out from joint diseases about a few weeks later. So I mean, I just like you said, it was 6 residents a year. They had a great reputation. I didn't want to leave the city at that point, and I felt very happy with it, obviously.
Yeah, I mean, it was a great program. And then you also were able to sneak a little biomedical engineering fellowship while you were in there too, which I think really probably helps when it comes to your 7 or 8 patents that you have in medical device design and some of the things that you have a passion for now.
I mean, I sort of am in the mindset that things work out for the best. You have to take a certain optimistic view. I mean, I actually was one of the residents who drew the short straw to end up in the bioengineering. It wasn't a voluntary
You were it was like the penalty box, huh? I didn't even know that such an exists.
Well, yeah. So I mean, I tried to make the best of it. So we ended up doing a lot of research and published a lot. And in the end, it worked out. It worked out quite well. So I would encourage your listeners, just kind of shit happens, if I can say that on the podcast, and just
sure you can.
Just
you go
accept it and make the best out of it.
Yeah. No, I love it. I love it. So. All right, so something strange happens. I don't know what you get through your residency. Obviously, you're doing really well, and you decide that sports medicine is your gig, and you're going to do a fellowship. But something something happened strangely, and you ended up in Salt Lake City. I mean, first time in your life outside of being born in Washington D.C., you're getting on a plane and you're flying someplace outside of the city of Manhattan.
So again, it's another one of these sort of drawing the short straw stories. I applied to, what would it be, like 10, 12 sports medicine fellowship programs. I remember being in awe of Curl and Job, which I believe you went to. I mean, this is Curl and Job was like the cream of the top. I mean, it was so sexy. All the doctors were taking care of the Lakers, the Rams. It just was like the place to be. And, joint disease at that time had a pretty good track record of having one of its residents showing up there. Just had a really good relationship. I thought I would be sort of the anointed person. I didn't get in. And I interviewed earlier in the process at Salt Lake City with Lonnie Paulus and Tom Rosenberg. And, they had a very strong program. And it turned out that I didn't initially match. And Salt Lake's Lonnie's program, which was then called the Orthopedic Specialty Hospital, had a spot. And they had already interviewed me, and they obviously saw some strength in my resume, and they took me, and that's where I went for the year.
Yeah,
and it ended up being, again, a
great fellowship. Yeah, I mean, those two were top of their game. I mean, that was a great education. I got to tell my funny story then, because Bill Levine and I are we're co-residents at the Tufts program, and we're both thinking about sports medicine, but Bill really wanted to do shoulder. And so we applied. He applied to both, and we both get an interview at Curl and Job, and they interview both of us. And then Bill does his, the fellowship at Columbia, and the rest is the story. But I said, Bill, I love you like a brother of another mother, because there's no way they were taking both of us. And Bill was much better credentialed than I was to get the job, but he took the Columbia job. I took Curl and Job, and there you go. The rest is the story. But no, I mean, those two guys were wonderful, and I'm sure it must have been a really great hands-on experience for you, getting more reps, all that you do, and then somehow, some way, you got lost. I mean, I would have thought you're coming back to New York in a heartbeat, but you got stuck in Arizona for a while. So you went into private practice in Scottsdale and Phoenix. Tell us about that.
Yeah. So I just want to back up a little bit, just give kudos to Lonnie and Tom, just in terms of, they really developed the endoscopic, was transtibial at that time for ACL reconstruction. Tom developed the endo button, which is the suspensory button that we use for soft tissue hamstrings. And I mean, both of them were so incredibly innovative that I think I got my innovative ideas and bugs during that fellowship period. To answer your question about Arizona and Phoenix, I did interview initially to come back to New York, but there really wasn't any spot or any place for me to say to come back to Manhattan. So the next best thing was I was looking for kind of a high profile type position. I thought, as a young buck, I'm like 33, 34. I thought getting kind of a high profile sports medicine, whether it was private-demics or academic, would really serve me well. I'd be able to kind of get involved and get that sports medicine practice going. So there was an opportunity to come to Phoenix and become the associate team physician with the Arizona Cardinals at that time. We had some friends at that time living in Phoenix, and we went down there, visited. It was totally foreign to me, from being from New York City, urban cowboy. Certainly Salt Lake City was kind of a transitional year, living in a house. I remember having to lock the doors because I felt so, it was so strange. It was just almost too quiet. I mean, I'm used to sleeping with noise, with sirens blaring and everything going on. So it was a transition. And I don't know, we kind of fell in love a little bit with Arizona. Certainly the job ended up being real excellent. Just a quick story about Salt Lake. The first night we get there, again, I don't know if you're familiar with this, Scott, but in the 80s, it was really big for people to break into your car and steal your audio stereo system.
Sure.
It would smash the window.
Yeah.
You got this thing called a Benzie box. Remember the Benzie box? Benzie box was this little thing you could kind of pull out and take with you to the restaurant.
Yeah, you take your radio with you. That's right.
Take your radio with you. First night in Salt Lake City, I'm saying, man, I'm like totally free. This is like, I'm not going to get anything stolen. Have the windows down, parked in a strip mall, come back from dinner, and the Benzie box is stolen. So,
oh man, I'll tell you. Nowadays they just throw you out of the car. They take the car, but no, that's awesome.
Nowadays everything's on the cloud. Nowadays,
yeah, that's true. So you were definitely married at the time. I'm assuming your wife went with you to Arizona.
Yes. Yeah.
And then so you're there for a period of time, so you get the calling though. I mean, we talked about this early on in the interview. You go to this Jewish high school, and your sort of passion for Israel. You go to Israel when you're younger, and then you get the bug, and you go to Israel and you work in Jerusalem, the Jerusalem Medical Center, for 2 years. I got to hear that story. That's really pretty fascinating.
So I was involved with taking care of the National Football League team. I got involved with the Major League Baseball, the San Francisco Giants, taking care of all their minor league system. I had the U.S. Olympics that I was getting involved with, gymnastics. Everything was like a sports medicine.
Yeah, you're kicking ass and taking numbers, man.
So I don't know. I guess after 8 years of being there, like you said, I grew up in Manhattan. I guess I felt at some point, I don't know, maybe it was a little bit of a midlife crisis, or maybe it was just my Zionism tapping into me. At that point in 2000, there was real hope for peace between the Palestinians and the Israelis. I thought it would be a good time maybe to make a change. I thought there's always opportunity for newer, younger sports medicine orthopedists to come in, take my spot, and I could kind of move on and kind of recreate myself and figure out what I wanted to do next. So it seemed like a really good opportunity. My brother lives in Tel Aviv. I got a lot of family in Israel, so it was a little bit of a natural or potentially natural transition.
Especially in the Palestinian-Israeli peace, it's hard to sort of harken back 23 years now to sort of have memory of that. But obviously, you're drawn, to family and your history. And so, was it difficult identifying a slot and getting an Israeli medical license, or was there, just tell us about that?
Yeah, so it was kind of my vision, and I kind of dragged my wife and three daughters, with me. At a difficult age, mind you. My oldest daughter was 13 at the time. My twins were 10. And, eventually my wife's in the art world. She got a job at the Israel Museum as an associate curator in photography. And my daughters, who had gone to Jewish schools, had some background, and they had a little bit of a tougher time adjusting to school. I thought with my training and such, it would be a great fit.
So it was a good fit for 2 years. Did you get the calling to go back to NYU? Did a position open up? I mean, that's another major shift after moving the family halfway across the world.
Sure. Yeah, so I actually got involved with taking care of a number of the Israeli Olympic teams through their Olympic Institute, got involved with taking care of a number of the professional basketball teams, a lot of former NBA, some college players. I mean, there's a whole world out there for excellent ball players playing in Europe, Russia, the Middle East, Asia. So I got involved with that. There was an opportunity for me to join NYU. I certainly didn't want to go back to Arizona. I thought Manhattan made the most sense. So Joe Zuckerman, who's like an incredible leader and chief, who actually just sort of started as a junior attending when I started my residency at Joint Diseases back in '86. So I made the reverse commute of going really from private practice to academics. Usually it's the academic private practice route.
Yeah.
So, and Joe was very forthcoming in getting me a position. And so I came back here in 2002 and have been here ever since.
Yeah, Joe is getting recognized at OSET this year, one of the goats of orthopedics for sure. So I saw on your CV, you've got so many papers with him early on in your career.
Well, part of that's from that research year.
Yeah, well, there you go. Thanks to Joe. So yeah, now it's 20 years. You're 20 years back at NYU Langone, and you're a permanent fixture within the New York orthopedic community, which is, there's no good competition in orthopedics in New York, right? There's just a few. Like, it's not that big a deal. No, it's not the easiest place to practice medicine or develop a new career in orthopedics, that's for sure. But look, there's a few things that I really want to focus on, which I admire greatly about you. And I want our listeners to know, why you're passionate about those. And one of those is really your being a mentor. If you take a look at your CV, it's a huge chunk of the energy that you put into your clinical practice. And so tell us why that's so important for you.
I mean, I think it's so important as an orthopedic surgeon to really provide some mentorship for younger medical students, residents, fellows, so that they can gain some of the skills that you have, that we have, and kind of pass it on. I mean, I feel very fortunate in terms of my whole medical history and my medical career. And I feel, not to keep the line running would be a disservice. And I get satisfaction out of getting a text from a former fellow who's up in Quebec City taking care of the hockey team down there saying, "Oh, check this out, Rob, I did an arthroscopic lateral in an hour and a half." I mean, that's like music to my ears, I feel like, I've mentored him. He's confident. He's doing a great job.
Yeah, I mean, you can only see so many patients.
I have to give him a special shout out. His name is Bogdan Matash. He's phenomenal. I think he's getting.
No, we love the shout outs. We love the shout outs on the Ortho Show. A 90-minute arthroscopic lateral, that is dude sweet, man, all day long. No, but I think that, like we were just saying, you can only treat so many patients in a lifetime, you personally, right? So you've been trained by some of the greats, you have tremendous experience, you're a master surgeon, and you feel obligated to pass it on, which so many of our Ortho Show alums do as well. So you bring up that one of the conversations points that I wanted to talk about was also the fact that you are not afraid to innovate and try new things relatively early on in the process of where they are, right? So many orthopedic surgeons are really sort of old school thought process. I've learned this. I'm going to keep doing what I do. Show me randomized controlled trials before I'm going to make any transition to something new or different. And arthroscopic Latarjet, you were one of the earliest, U.S. surgeons to consider arthroscopic Latarjet and then take the journey of learning how to do what I think is one of the most difficult arthroscopic procedures we do in the shoulder. And so what was the draw? Why? I mean, you had to be comfortable. You were doing open Latarjet. Why did you have to go and learn this crazy new operation?
Well, let me just back up a little bit again. I remember on my last, after I finished my fellowship with Lonnie and Tom in Salt Lake City, my good friend Jeff Halbrecht, who's just retiring now, he was with San Francisco. He was in practice with Eugene Wolf. And Eugene, again, one of the great leaders in arthroscopy and shoulder surgery, as well as knee surgery. He was coming out and doing arthroscopic Bankart. And I said, Jeff, I got to come out for a day. I got to see what Eugene's doing, because so much of the magic that's created is really portal placement when you get down to it. And if you have some basic skills, if you have the portals in the right area, things should really fall into place for the most part, assuming you have some, basic hand-eye coordination. So he was gracious enough to host me, spent a day, watched 2 or 3 cases. And I just came back so enthused, so excited, man. I've been spending the year during my fellowship doing open Bankart, and I love arthroscopic approaches. And I said, what Gene has going there with his arthroscopic Bankart is just phenomenal. So sort of the rest is history. He, in fact, at that time, he was fixing Bankart with the G2 Mytech anchor, the metal anchor.
Yeah, he and J.R. Richmond, who was my mentor.
Right. And they were using number one PDS suture. None of this fancy number one PDS suture, mainly because you had your Lymphatech or your Concept Spectrum suture passer, which again was very inventive, that could pass these small bored sutures through the labrum. So I came back to Phoenix. Fast forward, I get a defensive back who dislocates his shoulder, the Cardinals, and my former partner wasn't, well, put it this way, he was doing 2-incision ACLs, and he thought every Bankart, every instability should be treated open regardless, which is fine, right? And this is back in 92 when I went into practice. By 93, 94, I was doing arthroscopic Bankarts on collision athletes and had a pretty decent success with it. So I guess where I'm getting to, I'm fast forwarding now to LaFosse, who developed the arthroscopic Latarjet technique for Mytech, was that there was always a certain part of my heart that really got sucked into this excitement of seeing something new, brand new, that made sense, that technically could be, copied and maybe improvised a little bit, but there was the basic sense that all things are possible, and these surgeons made it possible. I always felt like this is the great thing about arthroscopy, is that there's room for innovation. I was one of the first people to be flown out to Annecy, France, to go spend some time with LaFosse. And when I got to Annecy and got to the operating room, and again, a shout out to Laurent LaFosse. The guy is amazing, amazing, amazing. He's a hand surgeon also, but he was doing this stuff that was just blowing my mind in terms of how he was approaching it, his mindset, his thought process, his humility. It just, everything about it, I just loved. So, came back in 2010, did my first arthroscopic Latarjet. And, I have to say, I do all sports medicine. So I'm not like a shoulder guy or knee guy. I kind of like everything about what we do arthroscopically. So I've never really been able to kind of expand my arthroscopic Latarjet. I do maybe 7 to 9 cases a year.
So for listeners, what Dr. Meislin is saying is that early on, the only way you treated a shoulder dislocation was to do an open incision. You cut the front of the shoulder, you sutured everything back together, and patients did pretty good. And then some innovative guys got together and decided that there's a way to do it arthroscopically, which means the smaller incisions. And they came up with these anchors, which had never been used before. And that's when you were on the cusp of that earliest innovation. You saw that. Then you fly out to Annecy, France to work with the master, Laurent LaFosse, early on in the process. And, I had that experience as well. And I can remember vividly being in the operating room with Dr. LaFosse and watching him do what he was doing. And I felt like I was watching Van Gogh. Like at the end of the operation, I was like, man, that is freaking beautiful. But I'm like, I really don't know how to do that. And so fortunately, the MyTech crew and Tom Borg, along with Sharif Bichet, flew us around, and we went to visit Matt Ravenscroft in Manchester, England. And Matt was a technician, and he's like, there are 34 steps in order how to do an arthroscopic letter J. And literally when you walked into his operating room, he had all 34 steps on the wall. And like, then I'm like watching this and I'm like, okay, now I see this. I think this is something I can do. And, I did 25 in clinical practice. I lost a day of my life every time I went to do one. Now I'm doing the Ivan Wand technique with the Halifax portal, the distal tibula, and I sleep every night before I go to bed. But, I really admire that about you. And that's one of the things that I see kindred spirits with you, Rob, is that you've always been available, like, hip arthroscopy. I was going to talk about that, but we're running out of time. But you identify a space, you identify an issue, and then you got the courage to go out and learn it. I think that experience-based medicine is just as important as evidence-based medicine, and learning from the greats and being willing to try something new and different is really fantastic. Look, Rob, it has just been a real pleasure, having you on the show. You're my go-to guys. Every time I meet you, I don't know what happened. All of a sudden now you and I are like the old guys in the room, it kind of bums me out. We were at random the other day. I look around, I'm like, where's Alan Barber? I'm like, oh shit, it's at least Rob's 3 years older than me, so it's okay. No, it's so listen, we greatly admire your skills and innovation, your mentorship, your 30 years of experience in orthopedics. I consider you to be a great friend and colleague, and I can't thank you enough for spending the time on the show with us today.
Well, Scott, I can't thank you enough for inviting me and sharing a half hour of your precious time. Because you're making orthopedics and sports medicine, you're democratizing it. You're making it easier for people to do it.
Yeah, approachable. That's really what we try to do here, right? My mother, Judy's always listening. We want to make sure that everybody that listens learns, is educated, has fun, and gets to meet amazing people like yourself on the planet.
You're a mensch. You're a mensch.
Yes, so are you, my friend. So are you. This is Dr. Scott Sigman, #FollowTheFro, host of The Ortho Show. Till next time.